A fissure, an anal fissure, which is what we are talking about now, is a simple cut in the inner lining of the anus. So this cut is called a fissure and it becomes very painful. The cause of fissure is hard motions, passing hard stools. Many a time a person gets constipated and because of that the opening which is normally closed and it opens to allow the motion stools to pass. If that stool is very hard, the bolus of the stool is bigger than the capacity of that place to stretch, then the lining just cracks. So that is the main reason why people have fissures. There can be other reasons, like there is a condition called ulcerative colitis, or it could be because of some other infection like tuberculosis at that site, which can cause fissures. But the most common reason for an anal fissure is constipation. The first sign of a fissure is bright red blood passed along with the stools. It could be a streak along the stool. It could be, it's called a flash in the pan. So in the commode, suddenly drops of bright red blood falls, and that really alarms the patient. But this is just the cut. If you have a cut on the skin, it bleeds too, right? Similarly, a cut in the inner lining of the anal canal causes bleeding and that blood falls into the commode. The symptom that is associated with this is severe pain. Now, the anal opening has a lot of nerve endings because it's a very sensitive area so that the body can judge when the stool is come down to that side, how much to stretch, how to handle this. We don't want any mishap occurring, right? So the anal canal has to be tightly closed at all other times. So it is a very sensitive area with a lot of nerve endings. And when these nerve endings are injured because of the fissure, there is very severe pain. So every time stools pass from there, there is bright red bleeding and severe pain. These are the two signs and symptoms of fissures. The moment a person has that severe pain and that bleeding, I think they should immediately go to a doctor because that is when, if they get the treatment at the right time, it will get solved immediately. For diagnosing a fissure, the main way to diagnose it would be the history itself. A person who's coming and telling us that they are constipated and because of that or following that they had severe pain while passing stools and there was bright red blood in the commode, in the pan. This is the typical way in which we can diagnose that yes, this person has a fissure. When a person approaches a doctor with such complaints of severe pain, bright red bleeding while passing stools and passing hard stools, then the first step in the treatment would be one, to relieve the pain, right? And to stop the bleeding. So bleeding will stop as soon as the fissure starts healing. And relief of pain is by local anesthetic creams. So the patient is given a cream to apply over it. Along with this, we recommend some fermentation methods so that that area is kept clean and that warm fermentation allows the part to heal. So for that, the best way to ferment that area is sitting in a tub of warm water. So local anesthetic ointments, especially which have to be applied before they pass motions. Now, there are two things here which many of the patients don't realize, and this is something the doctor has to explain to them clearly, that you have to apply the ointment not just on the skin surface but at the site where the fissure is. So the ointment comes with an applicator. That applicator has to be inserted a little bit inside the anus and the tube pressed so that the ointment reaches the correct site. Many times, what the patients do is they just apply it on the skin. Nothing is going to get absorbed from the skin. The absorption is from the inner lining, what we call the mucosal lining. So it has to be applied there. And for any medicine, think of it this way, that any medicine takes a little time to act. Even if we take some tablet for pain, we have to give it at least half an hour for the tablet to act. Local applications do not need half an hour time, but we need to give it at least 5 to 10 minutes to act. So if the patient applies the ointment before going to pass motions, waits for 5 to 10 minutes, then passes motions, then they are pain free. The importance of this is, and the second thing that we do is to give them stool softness, which will make the stool soft and pass easily. So when they are pain free, the patient allows the stool to pass. Otherwise, what happens is that pain itself makes them reflexly stop and not pass motions at all, because of which the next time they go to pass motions, it is again a hard bonus. So giving them pain relief, making the stool soft, will help them to pass motions comfortably. And to speed up healing, we advise them taking a what we call a seats bath, that is sitting in a tub of lukewarm water. And they have to be reminded, mind you, that they have to be reminded that please do not take very hot water. Take only that much hot water as is tolerable to you, because otherwise they can end up with burns in that area. Fissures, acute fissures usually heal within 1 to 2 weeks. There can be some very chronic fissures, fissures that occur repeatedly because the patient is continuously constipated or repeatedly constipated. They may take maybe 2 to 4 weeks to heal. And if there is an underlying other cause, like I mentioned, that tuberculosis, ulcerative colitis, which is giving rise to the fissure, it will heal only if the underlying cause is treated. So depending on that, the time period may increase. Otherwise, acute fissures, which are due to some episode of constipation or diarrhea, can heal within 1 to 2 weeks. Now, why did I mention diarrhea in this situation is because even with diarrhea, there is a lot of straining at times, which irritates the local mucosa, and that can again lead to an acute cut in the mucosa. So, severe diarrhea can also sometimes lead to fissure, but most commonly the cause is constipation. Fissure in itself doesn't have any risk factor, but a fissure can also lead to local infections. And when it leads to local infection, there can be something that we call an anorectal abscess. So there is pus formation in that area, because imagine that there is a cut in the inner lining. Our gut has a lot of flora in it, and that can cause some bacteria to enter into the cut and give rise to an abscess or a pus formation in that area. This pus formation, if it bursts through the skin, it can lead to a condition called fistula anal. So these are the two complications that are mainly seen with fissures or after fissures if it is not treated correctly and in time. A healthy diet can help to prevent fissures in the first place. A healthy diet, by which I mean a lot of fruits, vegetables, so that the stools are soft. For that, they also need to drink a lot of water. We need to drink a lot of water so that we don't get constipated. And as long as that doesn't happen, this fissure will not occur.